Minister, this government dealt with the momentous and urgent task of procuring COVID-19 vaccines for Canadians. That work has saved lives. Now, there's a parallel epidemic going on in this country that has not received the same level of attention and urgency. That's the toxic drug crisis, which is resulting in the death of approximately 20 Canadians a day. What will you do to procure a safer supply of controlled substances to stem the tide of toxic drug poisonings that have left too many Canadians without their loved ones?
So first, let me say, MP Johns, how much I appreciate your advocacy in this area. I know that you're very passionate, you're working very hard, and I agree with what you are trying to achieve at the end of the day. And although, this may be a little bit outside of procurement, but I want to say that we recognize the problematic substance use is a health issue. We're doing other, in other areas, we are diverting people who use drugs away from the criminal justice system towards supportive and trusted relationships in health and social services. And in budget 22, we invested additional 100 million. So now that's over 800 million that we've committed to support community-led harm reduction, treatment, and prevention projects since 2015. We're going to continue to do what we can to save lives to end this national public health crisis.
Minister, I'm urging you to take this on and wholeheartely. $100 million over 3 years for treatment, recovery, safe supply, education, and prevention isn't even close to adequate. When we've lost over 27,000 lives in this country, under your government's watch, and this is a health and human rights issue, Minister, and I'm asking you to take this on and to help lead with it. Now, obviously, Minister, you suggested that safe supply is not a procurement issue. Now, why are vaccines for COVID-19 a procurement issue, but a safe supply is not? Vaccines save lives, safe supply saves lives. If COVID-19 and the toxic drug epidemic are both public health emergencies, what's the difference? The difference is stigma, Minister, the stigma that devalues the lives lost of the poison drug supply. Your colleague, the Minister of Mental Health and Addiction, she told CBC that safe supply, quote, is going to be the way that we will save the most lives, end quote. Yet the Minister is not committed to a timeline for expanding access to safe supply, saying research is needed before it can be scaled up. Why is your government wasting time on pilot programs instead of ensuring a safe supply is available across Canada? Minister, the stigma, your government keeps saying it's a health issue. It's in the amount of money that you spend. It's in your policies. It's in the criminalization of people. It's in the laws that your government stands up for. What are you going to do about it? You're the Minister of Procurement.
So thanks, MP Johns. Look, again, you're championing this cause. I totally understand that, and I appreciate all of your efforts. But the departments are the clients. PSPC procures what the departments ask for. So, for example, in defense, we procure what defense brings forward as what they feel that they need in order to protect the military.
I get it, Minister, but you're sitting at the cabinet table. 20 people a day are dying. It is the leading killer between the ages of 19 and 39 years old in the province of British Columbia of unnatural death, more than homicide, more than motor vehicle accidents, more than all deaths combined that are unnatural. This is unacceptable. This response is unacceptable, and you're part of a cabinet that hasn't taken action to respond to this crisis. I'm asking you as the procurement minister, reach out to the Minister of Mental Health and Addictions, Minister of Health, and offer what you can do to respond like you did with COVID-19. It has killed more people in my province of British Columbia than COVID-19. And you're the procurement minister, and you got a lot of vaccines to British Columbia. Thank you for that. It saved lives. I need you to get a safe supply to British Columbia and to people across this country. People have to stop dying.